It is my pleasure to introduce our speaker for this evening's Language of Diversity Distinguished Lecture Series on the topic of celebrating Black women in medicine. We have the opportunity tonight to draw on the rich legacy of achievement and resilience of Black women physicians who have persevered against all odds. This serves as an encouragement for all of us, and it is truly a privilege to recognize the excellence in leadership and service of our guest speaker this evening. Dr. Sharon Thomas received her BA from Oberlin College, where she majored in English and biology. She is one of our own and obtained her medical degree here at the University of Toledo College of Medicine, where she remained for her residency training in general pediatrics. She went on to complete her training with a fellowship in pediatric critical care medicine at Loma Linda University's Children's Hospital. She is a proud member of the American Academy of Pediatrics and the Society of Critical Care Medicine. She currently works as an intensivist at the ProMedica Children's Hospital and serves as the Associate Program Director for the Pediatric Residency Program. In her role as APD, she enjoys teaching and curriculum development and medical education. Additionally, Dr. Thomas enjoys spending time with her family, her husband, and 3 children, and is actively involved as a volunteer in her church and mentor for aspiring physicians in the Toledo area. I have a favorite saying of Dr. Thomas that I like to think about when facing new challenges in my life. Instead of shrinking back when faced with uncertainty, she likes to lean into the unknown and say, well, today is a good day to learn. And today is a good day to learn. It's a good day to find strength, to keep going. And most of all, tonight, this is a great day to listen and to find hope in the stories of those who have come before us, because the struggles we're in today give us the strength we need for tomorrow. Please join me in giving a warm welcome to our very own Dr. Sharon Thomas as she delivers this empowering message tonight. Thank you.
Thank you very much, Dr. Jenkins, for that very kind introduction. Well, good evening, everyone. I am honored to be speaking to you today on the topic of the challenges Black women face in medicine. And as I considered my approach to this topic, I realized that it was an opportunity for reflection on my own journey thus far. And I also realized that I did not have any broader historical context, despite having familiarity with this topic in general terms and on a personal level. I hope you will find this as enriching as I have. And I decided for my title to call this The Incredible Legacy of Black Women in Medicine. So to begin, I will share a bit of my story. So this is a picture of me right around the time I began conducting serial examinations on my favorite stuffed toy, seen there, that's Baby Elephant. So my parents decided to buy me a doctor's kit. And so using it, I started to mimic my pediatrician. And by the time I was 4, I was telling everyone that I wanted to be a doctor. My parents were always supportive of me. And so they tried to provide me with every opportunity that they could for exposure to medicine. And so when I was in middle school, I met a physician who moved to the city I grew up in for her residency training. And like my parents, she was from Ghana. So through the networking that they had in town, they introduced me to her, and she became my first mentor in medicine. So this was the first time I met a physician who looks like me. And I was very excited about this because I'd been saying that I wanted to be a physician for a very long time. And so I actually had the opportunity to accompany her on while she was conducting her clinical work at times, and that had a great influence on me. Shortly after that, I met another friend of the family who was in her OBGYN residency. And so again, seeing these women who looked like me, who were where I wanted to be, had a wonderful positive impact on my journey. However, although I knew I was intelligent, I had good grades, I worked hard, I participated in programs to prepare. In high school and college, there were some negative comments that I heard from people who were in positions where they were to be advisors to me. So some of the things I heard in high school and college were things like, well, are you sure you want to be a doctor? That's so hard. You won't get in. You should probably consider another career. What about becoming insert your favorite career other than medicine? In medical school, these are some of the things I heard from my peers and colleagues on a fairly regular basis. In one form or another, I heard things like, you probably got here because of some sort of quota. It's easier for you to get into medical school than it is for others. You probably took the spot of someone who really deserved it. And then as I progressed in my medical education, you should choose a specialty that isn't too competitive. Now, all the while, of course, like all of my other colleagues, I was busy trying to study and learn the material. My husband and I had our 3 kids in medical school. And so along with all the normal challenges of medical school, we were navigating all those things as well. So then we get to residency and fellowship. And in residency, some of what I experienced on a regular basis, which differed from some of the experiences that some of my other colleagues experienced through that process, actually came from hospital staff, patients and families, which were things like, well, when is the doctor coming? Usually after I'd been in there for a while. You're the doctor? I thought you were anybody else. The nurse is here. And at times, housekeeping is here. So as an attending physician, some of these themes have continued as part of the extra challenges and barriers that I have to work through on a day-to-day basis. When is the doctor coming? You're the doctor? I thought you were. The nurse is here. There are times where there's deference to the closest person who looks the part as imagined by whoever I am in front of. And then there are times where I'm told that I'm intimidating for one reason or another once it's understood that I am who I say I am. So these are some of the things that I encounter and will have to work through daily. So the objectives of this talk are first to acknowledge the challenges Black women face in medicine. We're going to review the accomplishments of some of those who have paved the way despite these extenuating circumstances, and then celebrate the hope that exists as the legacy of these amazing women continues in me, my colleagues, and future physicians. And then last, I want to inspire all of us in medicine to do better and be better because of their example. So let's talk first about some of the challenges that face physicians today. So when we think about these issues, when physicians are in the United States are surveyed, the first challenge that many physicians report facing is administrative burdens and paperwork. So this relates to the electronic medical record, increasing time spent in documentation instead of in face-to-face interactions with patients, dealing with things like prior authorizations and surveys and regulations. So physicians cite this as kind of the most significant challenge that they are facing today. The second challenge is related to payment, seeing enough patients, the burdens of not feeling like there's enough time to see patients or having to see more patients than time allows in order to achieve the same type of financial, I guess, compensation. And this also refers to challenges and changes in billing and coding. And then, of course, all of us have experienced many changes in the last year as it relates to how COVID-19 has impacted healthcare in terms of telehealth and the challenges faced in terms of billing and coding and just adjusting to that way of having to interact with patients. Now, thirdly, what physicians report as a challenge facing us today has to do with burnout and decreased autonomy. The feeling that physicians are not actually in control of the care of their patients has led many physicians to feel like they are not practicing medicine as they envisioned, imagined, intended, or have experienced in the past. What is startling to me is that 91% of physicians have felt burnout during their career. And as a consequence of that, we also have an alarming rate of physician suicide. So physicians in the United States are facing many challenges. There are a lot of barriers. There are a lot of changes that have occurred in medicine over time. And these are the challenges that are currently most concerning. So let's talk a little bit about the challenges that Black women physicians are facing specifically. So only 2.6% of US physicians are Black women. And when you compare that to the US population, which is reported at 13.4% as identifying as Black or African American, it's very easy to see why Black women are underrepresented in medicine. So Black women often find themselves alone or in very few number wherever they find themselves. In addition to that, there is, of course, the escalating cost of medical education, which affects us all. Substantial educational and personal debt, which again disproportionately affects Black women compared to their peers. Salary inequity, career family balance, and the pressure of supporting extended families. Of note, some of these challenges are not specific to medicine, but are also present in many other professions, particularly in the United States. Now, before we move further in this conversation, it's important for us to acknowledge that many of the challenges Black women face in medicine and have faced result from the intersectionality of race and gender discrimination, and how both of those social identities and constructs work together to form what the experience of these women physicians has been in this country. So most of us have seen statistics at one time or another about the underrepresented numbers of women, of Black women in medicine. We've seen reports on the discrepancies in the access to healthcare, the wealth gap, the educational access, disparities and discrepancies in promotion. But I would like instead to explore this topic by looking at stories of the Black women who have overcome these many, many barriers over time. And I think that we have a lot to learn from them. So to begin, the first group of physicians that I would like to highlight will be referred to here as the foremothers. So these were women who were born between 1830 and 1925. Now, before we learn about these women, I would like to establish some historical context. I think we all understand that we are products of our society and that what is happening around us affects us and also informs what our experiences are. So these are some of the major events that had an impact on the lives of these physicians. So from 1619 to 1865, Africans were enslaved in the United States. In 1857, there was the Supreme Court ruling on the Dred Scott case that basically determined that Black people in the United States could not be counted as citizens. In 1859, just a few years before the American Civil War, the last ship of enslaved Africans arrived on the shores of the United States. And then, of course, from 1861 to 1865, we have the American Civil War. The 13th Amendment at the end of the Civil War was ratified, which formally abolished slavery with some exceptions. And then from 1865 to 1877, we had the Reconstruction period. So during this period of time, there was the development of the Black Codes, which if you are not familiar with that term, referred to a set of kind of rules and unofficial practices that attempted to recreate the former status quo that was established during the period of African enslavement in the United States. During this period of time, the Bureau of Refugees, Freedmen, and Abandoned Lands, called the Freedmen's Bureau, was established, which was a federal program that was meant to provide resources and empower the newly freed Black Americans. In 1866, the Civil Rights Act was passed to outline specific civil liberties for African Americans. The 14th Amendment the next year was to provide citizenship and civil liberties. And then the 15th Amendment in 1870 was ratified to guarantee Black men the right to vote. A few years later, in 1875, the Civil Rights Act guaranteed equal rights in public accommodations and jury duty. And then in 1877, the Reconstruction period ended when a deal was made with the Hayes administration to withdraw the federal troops who up until that point were occupying the South in order to enforce the protections and the rights of the newly freed Black Americans. We then move into the period that we kind of commonly think of as being the Jim Crow era. So that was the period from 1877 to 1968. And the Jim Crow laws were developed from what were originally the Black codes that were prevalent in the South. So over this time period, we had systemic segregation laws that were passed kind of on a state by state. This was a period of time where race riots and progressive increase in lynchings of Black Americans was occurring. In 1883, the Supreme Court invalidated the Civil Rights Act of 1875, which we just discussed on the previous page, therefore kind of rolling back the guarantees of the freedoms and liberties which were established for Black Americans. In 1890, states began to require these literacy and understanding tests for Black Americans to qualify to vote. In 1896, the Plessy versus Ferguson case determined that quote unquote separate but equal satisfied the 14th Amendment. And this was the case that basically sanctioned Jim Crow laws and led to the expansion nationwide. In 1909, the NAACP was formed, whose initial mandate was really to promote the use of the judicial system and the court systems to slowly reinstate the rights of Black Americans that had been rolled back at the end of Reconstruction. In 1910, Baltimore was the first city to approve the designation of specific boundaries for white and Black neighborhoods, and other cities quickly followed. So then we had kind of the official implementation of redlining. In 1913, the Wilson administration began federal segregation of workplaces, restrooms, eating places, and the expansions went on from there. From 1917 to 1918, World War I occurred. More than 370 Black Americans participated in military service to the US during that time. And during the Civil War, there was a huge migration of Black Americans to northern states, looking for more opportunities than existed in the southern states. In 1920, the 19th Amendment was passed, which allowed women to vote. So I want you to keep all of these events in mind as we talk about this first group of women who managed to really kind of blow through some of the barriers that existed while all of this was happening during that time. So the first person that I would like to discuss is Dr. Rebecca Lee Crumpler, who was born in 1831. She died in 1895. She was the first Black woman to earn her doctorate degree in medicine. So Dr. Crumpler was born free in Delaware, moved to Pennsylvania with her aunt, who often cared for sick people. So she had early exposure to the idea of caring for people who were ill. She once wrote, "I early conceived a liking for and sought every opportunity to relieve the suffering of others." And so this was kind of what drove her to pursue her career. In 1852, she moved to Charleston, where she worked as a nurse for 8 years. And then she impressed the physicians that she worked with her skill and with her ability to end suffering and to provide medical care. And so she was actually admitted to medical school through recommendations from the doctors that she worked with. In 1864, she was the first and only Black woman to graduate from New England Female Medical College, which closed in the 1870s. Initially, she opened a practice in Boston where she cared specifically for poor women and children. She moved to Virginia after the Civil War ended, where she worked with the Freedmen's Bureau, which we mentioned was the bureau meant to provide resources for newly freed Black Americans. And so she worked with other Black physicians to treat freed slaves who didn't have any other access to medical care. While she was in Virginia, she writes that she experienced quote unquote intense racism and that men doctors didn't acknowledge her. Druggists wouldn't fill the prescriptions that she wrote. And people said that her MD stood for quote unquote mule drive. Eventually, she moved back to Boston and then to Massachusetts, where after she stopped practicing clinical medicine, she's most well known for writing this 2-volume book called A Book of Medical Discourses in 2 parts. I actually don't have any pictures of Dr. Crumpler because we don't have any available, but certainly her work has made an impact. Next, we have Dr. Susan McKinney Steward, born in 1847 and died in 1918. And she was the daughter of a wealthy pig farmer, and so she had a relatively privileged upbringing. She was an accomplished organist, and what she did is used her earnings from teaching music to pay for medical school. She obtained her MD in 1870 from the New York Medical College for Women, and she was the valedictorian of her class. She then went on to establish a successful clinic in Brooklyn with a focus on prenatal care and childhood diseases. What's interesting to note is that although she was practicing medicine in Brooklyn during this time where there was not a lot of access to medical care for Black Americans, she had an interracial patient mix. She chose medicine in part because 2 of her brothers died during the Civil War, and she was very influenced also by the cholera epidemic in Brooklyn in 1866. So she ran a very successful private practice from 1870 to 1895, and then pursued some more graduate work on Long Island in 1888. She practiced at the Brooklyn Home for Aged Colored People and served on the board for a period of time, participated in missionary work and women's suffrage. She was a public speaker and is known for addressing the first Universal Race Congress at the University of London, where she delivered a paper entitled Colored American Women. She and her husband eventually traveled west, where she earned medical licenses in both Montana and Wyoming, and eventually she became the resident physician and faculty member at Wilberforce University in Ohio, where she remained until she passed away. Resident physician in this case means that she was the doctor on site. Next, I want to talk about Dr. Georgio E Lee Patton, Washington. So Dr. Washington was born in Tennessee. She was born into enslavement, and after the Civil War, she and her family moved for some opportunities. There were not a lot of educational opportunities for women like her or for Black people in general, and so her family worked very hard in order to try and make sure that she could get an education. She was the first in her family to graduate from high school, and then her siblings and her worked to save money in order for her to go to college. So she went to college in Nashville, and then she worked through school. So it took her a very long time to actually get through college. So even though she began in the 1880s, she didn't actually finish college until 1890 because of the difficulties that she had financially. She was one of only 2 women to obtain her MD from a Harry Medical Department in 1893. And after that, she decided she wanted to go on some medical missions. So she went to Liberia for 2 years, where she provided free healthcare. Unfortunately, on her return journey, she contracted tuberculosis, and her health was severely affected, and she never really fully recovered. She came back and opened a private practice in Memphis. She was the first Black woman to obtain both a physician's and surgeon's license from the state. And she and her husband participated in a lot of community efforts. She participated in the church missionary society. She was an active volunteer in the church and in the community. And she earned the nickname the Gold Lady because of her generosity to the Freemen's Aid Society. Unfortunately, Dr. Patton Washington died in childbirth, and unfortunately, neither of the sons that she and her husband bore survived. Next, I want to talk about Dr. Ruth J Temple. So Dr. Temple was born in Mississippi, and her family moved to Los Angeles after her father died. Her mother was a nurse, and Ruth, who was the oldest, had to care for all of her siblings. Her interest in medicine was sparked when her brother was injured in a gunpowder explosion, and she was noted to have said, quote, "At that time, I thought that women were nurses. I didn't know they were doctors. I said, that's what I want to be," end quote. She was invited to speak at the Los Angeles Forum in 1913, And during the Los Angeles Forum, by the way, was a Black cultural and political organization. And the members were so impressed by her speaking ability that when they found out that she was interested in medicine, they decided to sponsor her for a 5-year scholarship to the College of Medical Evangelists, which is now known as Loma Linda University, which is where I trained for fellowship. She was the first Black person to graduate from Loma Linda University in 1918. And then she went on to become the first Black woman licensed to practice medicine in California. She opened a clinic to serve the underserved in Los Angeles, and she was well known for her work in addressing underserved populations. She could not sustain funding for a free clinic, so she and her husband, who was in real estate, bought a house and converted it into a clinic, and thus became the Temple Health Institute. She also opened a health study club program, which was a program that provided health education to parents, teachers, and school children. And this model was then duplicated nationally and has become part of how we do public health outreach today. Eventually, she did an internship in 1923 to 1928 in a maternity service at the health department, and then decided to specialize in obstetrics and gynecology. Because she was noted for her commitment to preventative medicine in her community, the Los Angeles Health Department offered her a scholarship to pursue her master's in public health at Yale, which she did. She obtained numerous awards, honors. She was recognized by her community in multiple ways. There was even a week in March that was set aside and named after her in the Los Angeles area. And eventually the East LA Health Center was named after her in 1983. Next, we'll talk about Dr. Myra Adele Logan. So Dr. Logan was born in Alabama, and she had a relatively privileged upbringing as well, because her father was one of the trustees at the Tuskegee Institute, and her mother was a noted activist, particularly as it pertained to healthcare access and women's suffrage. So she graduated as valedictorian from Atlanta University. She got a master's in psychology and then won a 4-year scholarship to New York Medical College, where she graduated with her MD in 1933. She remained there after completing her residency and became an associate surgeon. And then she was also a visiting surgeon at Sydenham Hospital. One of the things that's most notable about her is that she was the first woman to perform open heart surgery. And at the time, it was only the 9th open heart surgery performed anywhere in the world. She conducted a lot of research, and her interests included antibiotics and their use. And she also ran a very successful private practice. She also was instrumental in developing some of the X-ray techniques used in breast cancer diagnosis and detection. And she was a charter member of one of the first group practices that combined multiple specialties under one roof. Of course, this is much more familiar to us nowadays, but at the time, that was uncommon. She had a commitment to social issues and spent a lot of time advocating for her patients. And she was the first Black woman elected a member of the American College of Surgeons. So here we see a picture of Dr. Logan and then see her at work. Next is Dr. Muriel Pationi. She was originally from Trinidad and Tobago and came from a family of physicians. 9 of her family members were physicians, and her father opened a private practice in New York when they moved to the United States. She obtained her degree from her undergraduate and her medical degree from Howard University, and then took over her father's private practice for 40 years. She was well known for serving underserved communities. She was an educator, a community activist. She served as a school physician, and she was considered one of the most powerful community members in Harlem. She was called the matron of Harlem Health. She is responsible for co-founding multiple organizations, lots of community activism. She was founder of the Friends of Harlem Hospital Center, and just has numerous awards and honors, too many to list here. She's also heavily involved in the Mentoring in Medicine program. One of the things that was near and dear to her heart was mentoring young people who wanted to go into medicine. One of the things that she's well known for was because of her position and because of her years and years of community service and activism, was that on her deathbed, she actually called multiple people, everybody from politicians and physicians and community members to her bed to give them instructions to make sure that the work that she had started was going to be carried on. Next, we have Dr. Dorothylavinia Brown, born in 1919 and died in 2004. So she started off life with a pretty tumultuous childhood. She was placed in an orphanage very early on in life. Her mother, who was a teenager at the time, was unable to care for her. And so she was kind of in and out of orphanages, foster care. Her mother tried to bring her back during her teenage years, and because of multiple conflicts, she ran away. So eventually she ended up with some foster parents who, once they found out about her interest in medicine, encouraged her to pursue it. She ended up being high school valedictorian and was awarded a scholarship to college. So she obtained her BA and then became an inspector in the Rochester Army Ordnance Department. She obtained her MD in 1948 from Meharry, and she was the only Black woman in the area doing surgery. She completed her residency at Meharry, and then became an assistant professor in 1955. While she was pursuing her surgical career, she faced nearly complete resistance because it was very uncommon for women to be surgeons, and certainly for Black women. When she was asked how she persevered, she described it with the quote I put up at the top, where she said, "I tried to be not hard, but durable." She ran for office and was part of the Tennessee State Legislature for a 2-year term, and then actually ran for Senate in 1968 as well. Proud to be a role model, she also said, "Not because I've done so much, but to say to young people that it can be done." And it was important for her, that she show people who maybe didn't have the opportunities that she had, and for her who didn't have any examples to look up to, for her to provide that for others. Next, we have Dr. Jane Cook Wright, whose father was one of the first Black graduates of Harvard Medical School, so she came from a medical family as well. She graduated from Smith, majoring in art, and then went on to medical school. She did an internal medicine residency, came back as chief resident after having her first child, and then she was originally hired as a physician for the New York public school system. After she did that for about 6 months, she came to work with her father, who was in cancer research. That's where she found her passion. So Dr. Wright is most known for her research, looking at patient versus tissue culture responses, looking at 2 new techniques for chemotherapy administration. And one of her biggest contributions is that she was one of the first people to test chemotherapy in humans, and was instrumental in the development of methotrexate, which is one of the most important cancer agents or anti-cancer agents that we have. She was appointed as the head of the Cancer Research Foundation at the young age of 33, and then eventually appointed to the President's Commission on Heart Disease, Cancer, and Stroke. One of the founders of the American Society of Clinical Oncology. She's a professor of surgery, and then in 1967 became an associate dean at the New York Medical College. At that time, she was the highest ranked Black woman at a nationally recognized medical institution. And finally, we have Dr. Blanche Louise Sellers Lavizo, who was born in 1925 and died in 1984. Now, she was known for quality care with dignity, especially as referred to low-income children. She was a graduate of Spelman College and Meharry Medical College, and then went to the Washington School of Public Health, where she got her MPH. She was the first Black pediatrician in Seattle, and she and her husband both left practices in New Orleans to pursue more opportunities out west. Of note, she was a friend and schoolmate of Dr. Martin Luther King. And she served as a community activist, as somebody who advocated for low-income children. She had a commitment to these populations and contributed time to many of these organizations that were meant to support these populations. One of the things that she's most known for is her early recognition of the role of social factors in health. Now, to us, this is very common. We talk about social determinants of health all the time, but at the time, it was not something that was commonly discussed. She used a multidisciplinary team on site at her clinic in order to address the multifactorial ways in which a person's quality of life and healthcare can be affected. So next, I want to talk about some of our more contemporary colleagues. So for context, up at the beginning, I still have that era with Jim Crow laws because of the overlap between the two time periods. So during this time, we had World War II, we had the President's First Committee on Civil Rights established, desegregation of the armed forces, and then from 1954 to 1968, the Civil Rights Movement. We have Brown versus Board of Education, which marked the end of legalized segregation in US schools. There was the Equal Pay Act, which prohibited sex-based pay differences, the 1964 Civil Rights Act, which outlawed discrimination in public places, among other things, the Voting Rights Act of 1965, which outlawed the discriminatory practices that were targeting Black Americans, especially in the South after the Civil War. In 1967, we had the Loving versus Virginia case, which ended race-based restrictions on marriage. And then in 1968, we had the assassination of Dr. Martin Luther King, which was followed quickly by the passing of the Fair Housing Act, which was to eliminate the bias and discrimination related to obtaining housing. In 1978, we had the Begg decision on affirmative action, which ruled that it was not constitutional for institutions which at that point had been trying to find ways to rectify some of the systemic disparities in education opportunities, that it was no longer legal for schools to make decisions on admission solely based on race, but that race could be a factor considered as part of the application process. In 1991, we had the Civil Rights Act, which added Title VII provisions, including the right to jury trial. And then there were many, many other embeds, including things like the Los Angeles riots, the election of the first Black president of the United States. And then, of course, most recently, we've all experienced kind of the George Floyd protests and all of the context surrounding all of those, all of that unrest, particularly last summer and the aftermath of it. And during this time, too, we had many African-American firsts as it refers to politics and art and entertainment and sports. So this is the context in which the next set of women were starting their careers. So first we have Dr. Claudia Thomas, who graduated from Vassar with honors in 1971. Now, one of the things I thought was interesting about her was that she was known for activism, and there was a 3-day protest at Vassar over the lack of support for Black Studies program, of which she was a participant and a leader. She went on to go to Johns Hopkins University School of Medicine, and she was an artist and was trying to find a way to marry art and medicine, and then decided that she wanted to become a surgeon. She found her niche in orthopedic surgery. And so she did her residency at Yale. She went on to become the first Black female orthopedic surgeon in the United States. Dr. Rosalind P. Scott grew up in a medical family. Her father was a dentist, her uncle was a surgeon, so she was familiar with medicine. She was a graduate from New York University School of Medicine, did her residency in general surgery, and then in thoracic surgery at Boston University. She was the first Mary A. Fraley Fellow at the Texas Heart Institute. She's the first Black woman thoracic surgeon and the first Black woman granted membership to the Society of University Surgeons. She has had a long career in academic medicine. She's done research in occupational stress in surgeons, health disparities in cardiovascular and lung diseases. She was a founding member of the Society of Black Academic Surgeons and Association of Black Cardiovascular and Thoracic Surgeons. And she's had a long history of leadership and mentorship as well. She tells a story of when she was in training, and while she was observing a surgery, she was in the OR, and one of the surgeons looked up and saw her and found out that she was a cardiac surgeon. This was in 1980. And she recalls that the tall, burly surgeon performing the operation remarked, "I didn't know they had let women in. I responded quietly but with resolve. They decided to let a few of us in on a trial basis to see if it would work." And I just thought that that really spoke to kind of how she was reassured of her position and of the fact that she deserved to be there and that it was important for her to be there. And obviously her career speaks for itself. Dr. Velma P. Scanterbury Wright is next. And she obtained her MD from Columbia University College of Physicians and Surgeons. She did a general surgery residency at Harlem Hospital Center. And she talks about how she once told that her hands were too small to be a surgeon, or too small for a surgeon. She did a fellowship in multi-organ transplant surgery and then remained as faculty at the University of Pittsburgh. And she was the first Black woman transplant surgeon in the United States. She did research and outcomes for organ donations and transplants, particularly in African-American patients. She did community education on health and the need for organ donation in the African-American community, and also did a lot of work at looking at the health disparities as it relates to the lack of access to to transplants for African-American patients. She was noted to say, quote, "Don't let the negative perceptions of others become your own perception of who you are." And she was also known to have said that she would not retire until there were at least 10 other African-American women in transplantation. She retired, I believe, in 2016, and at that time, there were at least 12 Black female transplant surgeons in the United States. So dreams do come true. Next, I want to talk about Dr. Karen Morris-Priester. So she has an interesting story because she wanted to be a doctor at the age of 15, but found herself as a teen mother at the age of 16. She eventually ended up having 4 more children and found herself a single mother with multiple children. And she tells it herself by saying, quote, "I was every stereotype you could imagine. I came from a broken home. I was raised in the projects. I was a teenage mother. I went to the public schools. I hadn't gone to college, and after my divorce, I became a single mom raising 5 kids. According to most standards, I wasn't supposed to amount to anything, but it's not where you start, it's where you decide you're going to end up." So Dr. Morris-Priester initially thought that after she had, moved on and was starting her life, that it was too late for her to go to medical school. So she initially went and got her bachelor's in nursing. She then attended the Student Medical and Dental Education program at Yale and excelled and was encouraged to apply to medical school, so she did. She started medical school at Yale at the age of 40. She got her doctorate in 2007 and was the first grandmother to graduate from the School of Medicine, although she hopes that's not the only thing that people will remember her for. She did her residency in anesthesiology at Brigham and Women's Children's Hospital, and now is a practicing anesthesiologist, achieving the dreams that she had as a teenager. She likes to encourage young people with her story of her non-traditional journey to medicine and tells them, quote, "I tell them they cannot allow anyone to convince them that their dreams are too big. They have to decide what they want and then set a goal, which is nothing more than their dream with a time limit on it." Next, we have Dr. Donna Mendes. So Dr. Mendes was exposed to hospitals early in life because her sister was very sick, so she was often in and out of the hospital. That was her initial exposure to healthcare. And so she saw all these people in the hospital, doctors, nurses, therapists of many sorts. And so eventually she heard about speech therapy and thought that maybe that's what she wanted to do. And then when she got into college, she changed her major to pre-med and decided that she wanted to go into medicine and become a physician. So she went to medical school. She went to Columbia University. And interestingly, as a fourth-year medical student on her surgical rotation, she was told that she was good with her hands and that she should consider going into general surgery. So she did. She did her residency and her fellowship in vascular surgery, and then became the first chief of vascular surgery at St. Luke's Hospital. She's earned multiple teaching awards, served on multiple boards and committees. She's conducted clinical research looking at cardiovascular diseases, particularly in African Americans. And she was the first Black woman who was board certified in vascular surgery. Next is Dr. Sandra Gadsen. So Dr. Gadsen obtained her MD from Meharry. She did internal medicine and then a nephrology fellowship. And she opened a practice in Gary, Indiana, founding the first freestanding dialysis center in that area, which up to that point didn't have any renal replacement access for the population living there. She has spent her career addressing health disparities in kidney disease at local, state, and national levels. She's a founding chair of the National Medical Association's Pay for Performance Task Force, which was meant to look at how the pay for performance metrics could have an impact on access to healthcare. She has a long distinguished career and a long record of service to the National Medical Association at the local, regional, and national levels. She has civic and community service. She's been an advocate for patients for many, many years. She's also an active member of her church, her local church, and has just been one of those people who has just made such an impact on the patient population in her area and on a national scale. Next is Dr. Vikisha Fripp, who did her undergraduate work at Fisk University. And while she was trying to apply to the joint program that Fisk has with Meharry, she was discouraged from doing the joint program because nobody completed the program with the full scholarship. Well, she became the first person to graduate from the combined program with the full scholarship the whole time because she was able to maintain the credentials to do so with her grades. She became a general surgery resident and was distinguished as being the intern, the resident, the chief resident of the year throughout her residency. And then she became the first Black woman to complete a plastic surgery fellowship at Cornell. She went back to Atlanta to open a plastic surgery practice, and then went on to be double boarded in both plastic and reconstructive surgery. And she has said, quote, "A goal is a promise you make to yourself, and I work every day to make my goals reality." Next is Dr. Jocelyn Elders. Now, Dr. Elders grew up in a small farming community in Arkansas. She was valedictorian in her high school, earning a full scholarship to college. She grew up on a farm, sharecropping. She was basically picking cotton, and one of her goals was to kind of get out of the cotton fields. She went to college, and then in college, she was inspired to study medicine by Dr. Edith Irby Jones, who she met while she was there when she came to give a talk. Now, Dr. Jones was the first Black woman to graduate from the college, and so that inspired Dr. Elders that she could do that too. She joined the U.S. Army and became the youngest commissioned officer in the Women's Medical Specialist Corps. She graduated from Arkansas School of Medicine on the GI Bill. But at the time, remembering the context that we are, having these discussions in, she still had to eat in a separate dining area because of the Jim Crow laws that were at work. She did a pediatrics residency, became the chief resident at University of Arkansas. She eventually got her master's in biochemistry and then became full professor at University of Arkansas. Much of her research was focused on growth and development, diabetes, and especially sexual behavior. In 1978, she became the first person to be board certified in pediatric endocrinology. And then in 1987, she was appointed head of the Arkansas Department of Health. She spent a lot of time there advocating for clinics and comprehensive sex education, which was one of her main focuses. At the time in Arkansas, more than 20% of the births were to teenage mothers. And so she worked very hard looking at access to birth control and condoms and sex education in schools, and was able to facilitate drastically decreasing that percentage during her tenure there. She was appointed the 15th Surgeon General of the United States in 1993, and she was the first Black person to hold this position. She's had numerous awards and honors, returned to the University of Arkansas, where she remained until she retired, and she's continued to be active in public health and in education. When asked about her obstacles throughout her journey, she said her greatest obstacles were poverty, racism, and sexism. And she has been known to say over and over and over again that you can't be what you can't see. Next is Dr. Louita Eke, who is actually known to our area because after getting her undergraduate and medical degrees from the University of Michigan, she went to the family medicine residency at the Toledo Hospital Family Medicine Residency Program. She eventually became the program director and was the first female and Black program director there for 7 years. She then left to become the youngest chief of staff at St. Luke's, and she was the youngest chief of staff in St. Luke's 100-year history, and she became the first female chair of the Department of Medicine. She was a founding program director, rather, of the St. Luke's Family Medicine Program, which graduated over 50 residents into family practice. And in 2012, she became the youngest woman to be named the Ohio Academy of Family Physicians Family Physician of the Year. She's participated in community service, and she's served on multiple boards and in multiple medical societies, and served as the representative to the state and national associations as the Ohio delegate for the American Medical Association. A few years ago, she obtained a master's in health professions education from the University of Michigan, and then is now serving as the Associate Dean for Graduate Medical Education at the University of Cincinnati College of Medicine. And last, we'll talk about Dr. Alexa Irene Kennedy. So Dr. Kennedy decided to pursue medicine halfway through college. She initially wanted to be a mathematician, and as she was doing her studies, decided she didn't really want to do that, became pretty disenchanted, wasn't doing well, was in danger, was put on probation, was in danger of failing, and dropping out of college actually, and after her second year, did a summer program which was meant to encourage minority students to study medicine. So she realized she had an interest in medicine. That following year, her junior year, she worked in a genetics lab and in a genetics clinic, and then realized that this was what she wanted to do. So she switched her major, graduated from the University of Michigan with a degree in zoology, and then got her MD from the University of Michigan as well when she graduated cum laude in 1975. She went on to do a neurosurgery residency and became a pediatric neurosurgeon. She was the first Black woman neurosurgeon in the United States. She was the chief of neurosurgery at the University of Michigan from 1987 until her retirement in 2001, when she and her husband moved to Florida. Well, she tried to retire. When she got to Florida, the local pediatricians there reached out to her because there was no peds neurosurgery support anywhere in the Florida Panhandle. So she actually returned to practice for another 8 years in order to fulfill that void. She has had numerous awards and honors. She had a lot of interest in neurosurgical techniques, and actually with 2 of her colleagues while she was at the University of Michigan invented the anti-siphon shunt, which is used in the treatment for hydrocephalus. She has had multiple honorary doctorate degrees. She was inducted to the Women's Hall of Fame in Michigan in 1989. And what she's most known for was her patient care first approach to her career. So we've talked about all of these women who've done all of these amazing things. And for all of us in medicine, these physicians are our forebearers and our colleagues. So as I reflect on the challenges we face in medicine as a whole, and on those faced by Black female physicians, there are several lessons that I think we can take away. The first is the importance of hope. To hope is to desire with expectation of obtainment or fulfillment. This is a picture of one of the first warm sunny days I took last year after the that initial lockdown period when we were all at the beginning of the pandemic when COVID-19 first began. We were so excited because it was actually warm enough for us to be outside. We could get a little bit of fresh air. We all know here in Northwest Ohio, it's very cloudy and cold and snowy for what feels like an eternity. And then all of a sudden the sun comes out. And so this reminded me of the hope that these women have had to have. These people were trailblazers who could not have done what they did without the expectation that they could move forward, despite the systems that excluded them and their patients, and despite the barriers. The second is resilience. Resilience is, one, the capability of a strained body to recover its size and shape after deformation, caused especially by compressive stress, and two, an ability to recover from or adjust easily to misfortune or change. So this is a picture I took of a succulent garden in the Los Angeles area. And succulents can survive and even thrive in very stressful environments. So it reminded me of resilience. So the physicians that we have discussed today teach us the importance of being able to recover from the stress that is inevitable in our lives and in practice. The third is perseverance, which is defined as continued effort to do or achieve something despite difficulties, failure, or opposition. And this is a picture of a tributary to the Colorado River. And I'm reminded of perseverance because water always finds a way. These women teach us the importance of continued effort in our careers and in continued advocacy for our patients' health and well-being. Hope, resilience, and perseverance enable us to meet the challenges we face in medicine. This is a picture of some beautiful rock formations that we saw in Utah, and I think would be very intimidating to climb. So it reminds me of something that's challenging, something that looks impossible. As medicine changes, we must be able to adjust to the challenges. We must be able to adjust and also at times to challenge the systems when they prevent us from caring for all of our patients. As these Black women physicians navigated their work, they focused on the reason they went into medicine. So we have to find the meaning in the work. This is another picture taken in Colorado where you cannot see where the river goes around the bend. And sometimes we can get so caught up in the difficulties and the challenges and the things that we don't like about it that we lose sight of our purpose. All of these women engaged in meaningful work that was not limited to the clinical setting, but also engaged their communities and also engaged in research and in policy and in advocacy. Ultimately, we must believe that what we do can make a difference. This is a picture of a garden in Illinois, just randomly in the middle of a park, but it wasn't really random. It was well planned, it was well tended, and it's full of gorgeous plants and flowers. These Black female physicians teach us that medicine is worth practicing for the benefit of our patients, and that those who will come after us, and for those who will come after us, whose journey may be better because of what we have done. And for those patients whose health and whose life journey can be better because of what we have done. So in conclusion, I still want to be a doctor when I grow up. This is a picture taken yesterday as I finished my service block in the PICU. It was a very busy weekend. There were a lot of sick patients. There was a lot going on. And it's something that I still love. And it's a place where I still think that I can make a difference. And I feel like it's what I was meant to do. In spite of the unique challenges that we face, I hope to continue the incredible legacy of the Black women physicians who have gone before me. These are my references. And these are my med school babies who are not babies anymore. I want to thank you all for your time and for listening to me this evening. And I hope that we can all move forward together, inspired to do better and to be better as we move forward in our careers. Thank you.